Welcome back to the Alight podcast. I am really excited to be interviewing today Dr. Dalia Elimam. She is a allopathically trained physician from Egypt who worked in standard conventional medicine for quite some time, and then, maybe somewhat to her surprise, transitioned to work with energy medicine techniques, specifically Eden energy medicine, or sometimes now called the Eden method. And Dalia really caught my attention because I myself have studied Eden energy medicine for about 15 years. I'm not certified or anything, but I've studied in a fairly focused way as a layperson and have really found it beneficial. So I am very excited to be in conversation today with Dr. Dalia Elimam. We're going to talk about her journey from what was a very satisfying and successful career as a physician into this more expansive direction. But we're going to pause first and show you all in the audience a little bit about what Eden Energy Medicine is. I wanted to do this anyway, but as I shared with Dalia before we began, I traveled this weekend and had sort of a long flight home last night. I got to bed at 1 in the morning, and I'm just noticing I'm energetically a little bit out of sorts today. I have some brain fog, and so it's the perfect opportunity in a time when a lot of people are feeling some disquiet and unsettlement as our world is really in a pretty significant amount of turmoil in a lot of places. It's a perfect time for Dr. Dalia to give us a little sampling of what are some things that you learn in Eden Energy Medicine that calm and center the body. So over to you, Dalia.
Thank you so much, Shara. I really appreciate this opportunity and thank you for the nice introduction. And I'm very happy to be here. So thank you for that. Let me start right now with giving the audience some energy medicine techniques, and you are really aware of them already, to ground you and clear the fogginess. And one exercise that I particularly love, and it's part of the daily energy medicine routine, are the 4 thumbs. And let me start really with taking a deep breath to center ourselves and set the intention, because energies move with our intention. Set the intention to calm and ground, because we can use this technique really for several things. But for grounding, that I do set the intention to ground and align and hook up to myself and bring myself back into coherence and alignment, I can start with the 4 thumbs. So I do tap on my cheekbones. There's a stomach 1 acupressure point for grounding. It connects to stomach meridian, which goes straight down the body to earth. So when we tap here a little bit and notice if it's hurting. If it's hurting, it means it's congested and really needs your tapping to move. You can also massage or stay here and press for a moment and see what feels good for you, and breathe. The energy moves with your breath. And then afterwards, we tap right below the collarbone, where this little knob is right here, where that middle knob is in the middle. And right underneath it is a dip. And right there, and massage here. Let me see if it works. Massage here a little bit, or tap, whatever feels good to you. And that also keeps your energies moving forward and connecting all the meridians, the energy pathways together. And then for your vitality, and we call it the energetic cup of coffee, we thump on our thymus, so a little bit more back. And thump here to activate your strength and vitality in your body. And then
I love the thymus thump. All of these they really are remarkably powerful.
they have so many benefits. So that's why I set the intention. You can also do all of these for immunity, for vitality, for joy, for healing bigger issues. But right now for our grounding. And then there is a spleen thump, where we go here to the side, right here under the rib cage, underneath the armpit, and thump here on both sides. And stay there for a few breaths, or massaging, or pressing, or just moving figure eights around it. These four thumbs are very good for grounding and bringing your energies back into coherence. My favorite really is, and I blend two of them, and you open your third eye like you would open an eyelid.
Mhm.
And take a breath for clarity and vision so you can trust moving forward and trust what you're seeing. And then the crown paw. Really open up your crown. You take your fingers in the midline of your forehead, dip in a little bit, and really open up and make the intention to open up your forehead. And then you move up along the midline of your head, all the way, always from the midline and out. Dip in, press in a little bit, and open up. And on the top of your head, and then even in the back of your head, all the way around to the back of your head and the back of your neck, and then pull the energies down your shoulder. And you can do this once or twice. It is really for opening up your head if there's congestion of thoughts, or even if your energies are scattered or scrambled and you want to come back. It really, first of all, releases all the congestions and the unnecessary thoughts or worries, and brings more clarity and inspiration.
Yeah. Thank
Very
you.
good for headaches too.
So good. And so anyone who's intrigued by this can find this is called the Eden Method 5-minute daily routine. There are probably hundreds of videos of it on YouTube. And we're gonna transition very soon here to hearing about Dalia's story, but I want to just mark that I think one of the most wonderful things about Eden Energy Medicine is there are two ways to experience it. One is with a highly trained practitioner like Dr. Dalia, but the other is on your own with YouTube or Donna Eden's books or online classes. And it has just meant so much to me over the years that Donna and the Eden Method have made it so accessible. And because it is a fairly complex modality, it's really meaningful to work with an expert practitioner, but it's also so accessible. Anybody can learn aspects of it and do it at home. And I just think that is one of the really most enormous and beautiful contributions of the Eden Method.
Absolutely, it is. It is self-empowering and it's self-healing and it's very simple. Everybody can do it alone, can do it for themselves, can do it for their friends or their loved ones, included in their practice. It's such a comprehensive modality, and this is what its strength is, that it is allowing you to take care of yourself. So you do not have to
Yes.
wait for an appointment. You don't have to wait for insurance. You can support yourselves with everything that you're already doing and bring your
Yes.
body back on board, bring it on board to do self-healing. And
Yes.
yes, and thank you for mentioning and emphasizing this, because this is one of the most important qualities that I have found in this modality, the self-empowerment and the easiness and the accessibility.
Yes, and I'm sure that you give your clients homework. So we'll get to talking about how you as a practitioner merge kind of the expert care that you provide and then what people can do on their own. But let's talk first about how you got here, because I imagine that when you trained as I believe, did you tell me pediatric neurologist?
A pediatrician.
As a pediatrician.
A pediatrician, and my specialty was hematology at that
Hematology.
time.
Okay. So when you trained and began that career, I'm sure you did not anticipate being where you
No.
are today. So just tell us about how this has all unfolded for you in your career.
So it is a really interesting journey for me. Still looking back, I think, how did that happen? Absolutely. So in Egypt, I was staff there, a pediatric hematologist, and I was interested then to subspecialize more into genetics and genetic disorders and metabolic disorders. So that's when I came to the States in 2006 to do my PhD in genetics. and I did my work at the University of Miami. And then wanting to, more doors open to learn more, and then wanting to stay here, I was going to go into clinical residency here to get board certified and be able to learn more and get more training when my visa didn't allow it at that time. So I had to wait for our lawyer to change my visa so I can continue the program, the program I had just gotten into. And during that time, waiting for the visa, I just got interested in all these experiences I already had as a pediatrician. So working with children, there's because they don't speak and tell you this is what I'm feeling and this is what's going wrong. You do rely a lot on your senses, on observation, on smells, on progress of illnesses. You really have to look and to feel and be really present. And so I wanted to understand more what that all was about. And I learned more about holistic medicine, and I got more. I was always knowing that there's something else going on that what we can measure and test for. That's practically it. So I did some self-education and self-studying at that time, and did a lot of volunteering in childhood meditation and met many people who also do childhood yoga and just other holistic modalities that support children in their health. And met somebody who does Eden energy medicine. She just introduced me to it really, and I got curious about it. So I just took a class, a free webinar, a class online, got really interested in that, and then wanted to take another class and paid for it. And class one went to class two, to class three. And then I became, after 5, 6, 7 years later, now an advanced energy medicine practitioner and changed my career entirely from Western medicine to just being a full-time Eden energy medicine practitioner. My hope is to bridge them, to introduce them, because the energy system is a system that I learned is not taught in medical school at all. This is the one system that we are not dealing with. And it gave me so many answers to why are we getting sick? Why are these children responding to some interventions and medications and others are not? Why are we not healing? Or why are some things that just acutely and pass within 2 weeks and others really take years? And what is chronic and what is acute? And what is autoimmune? Where does it come from? And so many questions got answered, all these things that I couldn't answer with Western medicine alone. As strong and important Western medicine, I really think of it that they have to go together because we are not just flesh. And I got really passionate about that part, about healing that piece that we do not have access to or that we ignore or just don't know about. And I think I really found my passion. I'm really 100% in it right now. And that's how I'm here. And
It's so wonderful. And although I'm not an expert in Eden energy medicine, I know enough about it to be able to guess that it's probably a very easy system for you to understand as a physician because it does talk about so many systems of the body. And so I'm guessing it must have just been very exciting for you to match your anatomy and, all your clinical knowledge with what Eden Energy Medicine teaches about the body's systems.
yes, absolutely. The physiology, how the body functions, like where it really starts with the energy explained so much more. I wouldn't say it was easy because I had that background, but it just really explained that background that I already knew. It just gave it a much more deeper meaning and understanding to me, the whys and the hows. And I loved about Eden Energy Medicine that there is a physiology, there is a function. We don't just work with one energy system. We work, as you mentioned, with 9 of them, and we can be really specific to work with the energies of each organ, or with the mind, the clarity, the focus, the memory, and with our emotions as well. So it really came all together, and it can be easy for everybody because the expert is you. You are the expert of your body. What you're learning in Eden Energy Medicine is how to communicate to your body's wisdom and the ability to heal. It does not need any other background before. You can come from any other. You can be a baker. You can be a teacher. You can be a doctor, or you can be a technician or an engineer. This is about you and your body's wisdom and your ability to heal, and your background will never interfere or you start right there and you become the expert of you.
Yes. And I think another really wonderful thing about Eden, of course, we just gave a tiny taste of it with those very preliminary exercises, but the way that the Eden method is designed is that you can feel a difference very quickly. Like if somebody is feeling out of sorts and they do figure eights or they do a cross crawl maneuver, you can feel different in 10 seconds, 1 or 2 minutes. And that is, as you're saying, it's not only very empowering, but it's a very visible, palpable difference in well-being.
It is absolutely. It is not even a minute, it's a second. The energies shift within seconds. If you have a certain thought and see how your body responds, that's your energy moving. If you see something exciting and see how you feel in that moment, it takes a blink of an eye and your energies will shift.
Yeah.
So it doesn't take time. And this is the beauty of it. And with some people who have concerns that have been there for longer, it just needs consistency to reshift your energies because they develop
Right.
patterns
Right.
over time. And this is when we get sick, when they get that stuck in a pattern that used or was beneficial for a certain moment or protective for a certain moment and then is no longer needed, but the energies
Yes.
just stay locked in a certain pattern. So it's really just the simplicity. So some people would think they would need a lot of energy medicine. It can be so for some people just one technique for one moment. For some people,
Yeah.
it can be a session. And for some, it just needs the redoing and the consistency to shift. But as easy as it is and as fast as it is really just a blink of an eye.
Yes. And when you and I spoke last week, did you tell me that you do still sometimes work in Egypt?
I do. So
Because I'm curious, my larger question is how much contact do you have with people practicing allopathic medicine and what do they think
Mhm.
about
Yes.
what you're doing now?
Yes, good question. Thank you for the question. So here in the United States, because it is important, I do only practice now Eden Energy Medicine. I do not diagnose or treat or write prescription as a physician. I'm certified, but I didn't continue to get licensed. I completely shifted my pathway when I
Yes.
learned about Eden method. In Egypt, I'm still practicing. Yes. So whenever I do visit and I go back and I see some patients online through distant work as well. I do see them. I follow up some of the families that I've been working with. I get new patients when I do go back, and I work with them with both. So my consultation is usually mixed, right? I get an intake like a physician and MD would do from Western medicine, but I really do manage now all of them only through the Eden method.
Wow. Can you tell us more about that? Like
I
how did your Egyptian patients' families respond to that? Um is it something that they warm to quickly? And how do you see Eden approaches helping? Is it still only children that you work with in Egypt as a pediatrician?
so my patients that come to me are mainly children, yes.
Yes.
But I
And
also work with adults now because with the
okay.
energy medicine, you can access the
Yes,
energy system. It does not
absolutely.
matter the gender or the age.
Yeah.
So I see also friends and family or anybody who gets referred for energy medicine
Yeah.
specifically, yes.
Yeah.
So with the children, what I have been, well, I was a hematologist back there, so I do support still the families with children who have Middle Eastern, Mediterranean illnesses and anemia and thalassemias and iron deficiency anemias, but I do also support their metabolism. I can now support them work with the side effects of their medications. I can prepare them for interventions and surgeries. I can make them more vital, them more vitality. I can increase their immune system. So just in generally support their body to deal with the illnesses. And what I have newly, since I did in energy medicine, seen children with autism and with ADHD and difficulty speaking. And what was so phenomenal to watch was we have a technique, and the Eden method is the Wayne Cook, and you're probably very aware of it, where we usually do it when energies are scrambled.
Mhm.
And I worked with a child that had difficulty speaking and was diagnosed with a Budd-Chiari syndrome. It's a genetic disorder of a neurological developmental disorder, and couldn't speak and took its time until it was 5 years and couldn't go to school. And I taught the mom how to do the Wayne Cook, and it took them around 6 months. And he is in school now. Delayed, of course, started like at the age of 8, maybe with in first grade, was delayed, had special support. But now I just seen him, after 1 year, and he's doing wonderful and is in school plays and just with a very simple Eden method technique. And that was just really amazing. And one of my family members had called me because their child wouldn't want to read at all, wouldn't want to read at all. And I'm doing the Wayne Cook because it's just easy and because the brain development in children needs the coherence and that encouragement of the energies crossing over and not being scrambled and unscrambling their environment. Also giving that same technique to their mom and
Yes.
just seeing how easy homework was now and how loving they were now to books. It's not the child, it's not the parent, it's not their IQ, it is just energy.
That
So,
is so, well, I was about to say amazing. I'm not amazed because I know that Eden Energy Medicine has this capacity, but I guess I'm in awe because it is so beautiful to be able to help a child and a family like that. And so many families are trying so many complex interventions. What's so amazing, and some of them may be very valuable and helpful, but what is so amazing about the Eden approach is it's these simple things that you do to move your body and adjust your energy and maybe your family members as well, so you all are a more
right, right.
harmonious unit. And I mean, these stories abound in Eden Energy Medicine of people who experience radical shifts in their function and well-being.
Absolutely, absolutely. And I see adults with headaches, with neck pain, where they cannot sleep. The main things, do you have something for that? Because they usually do try everything, the
Right.
medication, their lifestyle sometimes doesn't allow you to just rest and rest. And energies are so quick to respond, just to allow the body to remember how it feels and how to relax and how to be safe taking a nap. Because sometimes we
Yes.
feel we cannot afford it. We feel guilty slowing down. So a
Yes.
lot
Or
of
the nervous system is just not calm enough to slow down.
absolutely, yes, absolutely.
And did I see on your website that you're also teaching in the
Yes,
US? You're teaching in
I'm
Eden
teaching.
Energy
So I'm
Medicine?
yes, so I am an advanced energy medicine practitioner and I'm authorized Eden method teacher. So I do teach level 1 fundamentals of energy medicine, of Eden energy medicine, and I do also classes on a monthly basis at the center where I work in Minnesota.
Wonderful. So wonderful. It sounds to me like you were happy in your career as a pediatrician, and then you did a PhD in genetics here in the US. So that was a satisfying path for you. I'm curious. So it's not like you were unhappy and you were looking to be happy and fulfilled. You went from something you were quite happy with to kind of a further blossoming. How do you feel now as a healthcare provider as compared to how you felt when you were just staying within the allopathic modality?
I feel whole and I feel complete and I feel exactly where I needed to be from the beginning. It just makes all so much sense to me now. I just want to say that, and this is not just to explain where I was. I was in medical school, the first of my batch every single year. And then I became staff and got awarded there, and I was teaching there as well. So I was very satisfied. And I loved my hospital, I loved my department, I loved my colleagues, and definitely loved the work with the children. So I had no reason to look for anything else. So when I found Eden Energy Medicine, just the meaning, because when I did work as a pediatrician, there was always a limit for what we can do. Sometimes we would just it ends here. There's no more we could do. And my interest in genetics was because we were seeing many children who were born with genetic disorders or metabolic disorders inherited, where we couldn't do anything about. And so I wanted to come to the US to learn, how do we do this? And Jen, it just, and then when I learned about Eden, the answers were there. The answers were there. What were we missing? And it's not about more knowledge about what we already know or going deeper. For me, it wasn't. It was more of what am I sensing and feeling and hearing and seeing? What are we missing when something, and why are is in twins, one is responding, the other isn't. So, and I see a lot of this in the genetics. So just being part of the genetic fellowship at the University of Miami, I saw so much. And with Eden, it gave me just so much answers. And this is where I want to do, because sometimes the answer and the homework and the management is simple. And we spend so much time and finances and emotional invested, and the family suffers so long. So something that can be very simply managed and dealt with. And I
Yes.
felt that I was needed there, and I really enjoyed the work because I can still connect with the children, connect with adults, connect with anyone who needs it, and have that intimate relationship as a provider and in healthcare. I didn't lose that, and this is what I was passionate about mainly. But now really being able to allow them, first of all, to take their healing in their own hand, to give them hope, and to have them know that they can do something, that it's not
Yes.
hopeless, that there is something you can do.
That I just want
Mm.
to highlight because I do feel that we're at a point where so many people are seeking that. And of course, so-called conventional allopathic medicine, it has a lot to offer, but it is still a paradigm where there's the expert and the patient. And if the expert physician or researcher can't help you or fix you, or if you don't like what they're able to offer, I think so many people still feel very helpless and disempowered. And I love, as you're saying, that with Eden Energy Medicine, you can do so much for yourself. You can shift things yourself. And I mean, we may or may not want to go into some of the stories in the whole Eden community, but about, very significant recoveries. And maybe you have seen some in your patients or acquaintances, but there are people who use Eden Energy Medicine and they experience complete cessation of serious autoimmune illnesses. And of course, the beautiful story that people can look up if they want to is that Donna Eden herself developed these techniques when, by about the age of 30 or 35, she had fairly advanced MS and
Mm.
they think had had cancer and a heart attack and was becoming quite disabled, had been able to see and feel energy her whole life, and sat down one day and thought, there must be something I can do for myself. She's now, what, 80 years old and has been completely free of MS for about 50 years and has the brain scans to prove it. But anyway, I just wanted to highlight that, and you're welcome to add anything there if you want to. But this topic of people being empowered in their own healthcare and wellness is just so powerfully important.
Yes, absolutely. And I'm so, so grateful for Donna sharing her story and trusting and what
Oh, yeah.
she saw and what she experienced and sharing that. I really honestly, with all my clients or patients that I see, I don't know where they would be without it. I don't know where I would be. It helped me, it helped my family, it helped relationships. It's just such an important modality and something so important to pay attention to when it comes to our health. And I
Yes.
also want to say, if someone needs surgery, they need surgery. If
Yes.
they need medications and they have been prescribed, they need their medication.
Yes.
It has to go together. There is something that either can maintain and can be very preventive for you and prophylactic to keep you healthy, to keep your energies balancing on a daily basis. It can help you if you are on medications to have those, you respond to those medications, to maybe lower your dose, you maybe be able to get off it, but it can help you also deal with the side effects of it. If you have an end stage disease, it can help you really bring back your vitality or maybe even heal from it. We don't
Yes.
promise, we balance the energies. But I want to say that if you have any allopathic care, if you are under a doctor's care right now, you need to do what you need to do. But when you
Yes.
bring your energies on board, you might be really amazed that either you respond or you really heal or it gets much easier. So I personally, from what I've seen and experienced, there's not such thing that a chronic disease. You're not
Mhm.
stuck. Your body can do something. When we go back and understand what shifted, when did you get sick and how, and then address the energies at that point and rebalance them and tell them it is safe to move and shift,
Yes.
there is just so much. There is so much hope in this. So much.
Yes.
Yes.
Yes. Really, really true. And for anyone who wants to go deeper with some of that, go to the Eden Energy Medicine practitioner directory and find a practitioner in your area. Some work remotely, buy Donna's books,
Mm,
etc. You've mentioned relationships a couple of times, and I didn't necessarily have in mind that we would talk about that, but then I noticed this morning on your website that you do some teaching with what Donna Eden and her husband David Feinstein, who has a PhD in psychology, I believe, what they call
mm,
the energies of love. Donna
mm.
and David have written a really in-depth and powerful and I think popular book called The Energies of Love. But since you've talked about the relationship in your experience between children's wellness and their parents' energies or other relationships, do you want to tell us about how you work with people in relationship, couples, maybe parents and children, using Eden techniques, not just for the individual, but
Mm.
for the ways that individuals are relating to each other?
Yes, for families. And it is so, so important. So, two ways. The first thing is, and I will go back to talking here about the children. So when children, especially the young ones who were just born or in their first 3, 4 months, when children come to me or parents bring their kids in with something that they're not responding to something prescribed by their pediatrician or it hasn't been working, I often look at the energies of the mother because we all affect each other. And sometimes it's really the mom, the mom that needs the energy to be shifted for her. Not that there's anything wrong or bad with her, but just we influence and impact each other's. And through our pregnancy, the energy of mom and her environment affects the child in utero as well. So
Yes.
there I do look at the mom and the father and their relationship as well. The relationship, the energies in the environment where the child is growing up. So that is one thing. So I pay attention to the family in that. And the other way, when I do a relationship work, which I do really love and had incredible, incredible loving experiences with, is when there are partners that want to enhance their relationship or having conflict and went to therapy with it and have done their own therapy sessions and relationship studies and it is not working for them, and then allowing them to look at the energies and look at each other through the lens of energy. And this is what Donna and David's the energies of love is about. So I studied that intensively. I was so interested because I'm a wife and I'm a daughter and I'm a sister and I'm a mom, and all
Yes.
these relationships matter and they can be devastating even just with small conflicts. So I was intrigued to enhance and improve my own relationships, especially when I had a teen. So I wanted to see, so where are we energetically? Let me look at this from a different perspective because like many other moms probably feel we're stuck and we just have to go through these years. Well, you do not have to just go through them or hold your breath until it's over. So I looked at them and looking at each other through the lens of energy. What is our sensory style? How do we express ourselves? What are we actually saying and what do we mean by that? And then looking at where we come from. And then also, once we know and understand that your energies are different from mine, the way I do respond when I'm stressed and what I need in that moment is very different.
Yes.
than what the other partner or what I or you would need, or how do we express? I need to be heard. Somebody else, I need to be seen. Someone else, I need to be hugged. And just I cannot respond to someone who's really kinesthetic and needs that hug and that emotional support and look them in the eye and tell them you are wrong. But for somebody else, also I can hug them, but they really need me to say, I hear you.
Yeah.
So it is really how do we see each other from the energy? And then it brings out so much more compassion and a deeper understanding to look outside of the responses, like with our mind, and just understand what is being moving here and what needs to be
Yes.
balanced. And then the most powerful thing, to support each other, balancing each other.
Yes.
To
Yes.
balance, I can balance my daughter. I can allow my husband to balance me. And remember, this is not me. This is not you. This is our energies being out of
Right.
balance. We're stressed right now.
I think one of the biggest contributions, at least for me, from the Energies of Love, which I should reread because it's a pretty in-depth and powerful book, but one of the biggest things I gained from that is a deeper recognition that if someone I'm close to is behaving in a way that I feel is hurtful, it's not necessarily that anyone is doing anything wrong. It's different energy styles, which of course Donna and some others can see clairvoyantly in someone's energy field, but any of us can learn about so that you recognize maybe both people in this dynamic can polish and soften and refine how they are being in the relationship, but it's also just two different styles interacting that can have understanding and compassion for one another. And that is really pretty amazing.
Absolutely. You said it wonderfully and beautifully. Yes, absolutely. And our rhythms also, we have different rhythms. So if I'm
Yes.
a water and I take things slow and I'm really deep and poetic and like to think and analytic, I'm very different from my
Yes.
husband who's a wood and on projects and go, go, go. And this has to be right and has to be perfect and it has to be now. And just understanding that, we can
Yes.
be different,
Yes.
but I can look at him and fall in love with him because look at your energies.
It is so valuable. I'm laughing because I'm not going to call out any of my family members, but I have a cherished family member who is a water, and this person disappears, flows from here to there, and the rest of the family group will make a commitment to say, prepare and clean up dinner together. And the water in our group is that person is there one moment and completely gone another moment. And once I read, this was Donna's daughter Dondi Dalian's book about the five elements. Is that the
Yes, Don
title? Do you
Vidal. Yeah.
remember?
Yes, yes, that's a title, The
The
Five
five elements.
Elements. Yes.
That book was so helpful to me in my parenting. I am blessed to have three children, all, of course, very distinct, unique people, and I'm married. And Dondi explains so well, and then Donna and David further in the energies of love. You can gain so much compassion for your loved ones and yourself
Correct.
as you just become aware, oh, that person's style is not wrong or bad or inferior, and neither is mine, but they are quite different. And it helps to recognize
And
that.
right. And we see the colors in the family rather, and
Yes.
not the differences, but really understanding each other. And also then we will learn why are we actually together? Because we really need all these elements. And
Yes,
Dondi's book is fascinating. It's a
it
very
is.
easy read. She has also a
Yeah.
lot of videos on this issue, and she has it in a very fun, enthusiastic, and engaging way. I would really encourage everybody just evoke or awake your curiosity and look them up. It's such a fun topic also just to read and understand not just our family but also really our boss and our
Yes.
colleagues and our students,
Yes.
and so important for teamwork as well.
It really is. Do you think about doing some writing yourself? Because you come to Eden Energy Medicine with really extensive medical credentials. And so I'm curious about whether you might have any writing in mind. And also, I know that Donna has taught at the Cleveland Clinic and maybe Mayo as well. Have you yet, or are you interested in teaching in medical schools?
Absolutely, absolutely. That is really one of my goals. When I mentioned, that I would like to bridge, I really want to introduce the energy system to medical school for all the young physicians out there to know that there is another system. Look at it, give it a chance, right? Combine it, take care of it as well, pay attention to it as well. Writing, that has been a long time goal for me to write. I must say that I do really enjoy the teaching in person, and I'm now starting to do online as well, just to get the word out and have people know what it actually is before, I do have books. So sometimes it's easier just to hear and to listen and to ask a question, get an answer. So
Yes.
I'm focusing more on the teaching right now, but I'm definitely making my notes and preparing to write. Yes, thank you for that
Yes.
question.
Yes. Well, I just think it is really exciting and valuable when someone like you merges these diverse and complementary modalities. It really means that you have a tremendous amount to offer because you see so many perspectives and types of knowledge simultaneously.
Mm. Thank you, Shara. That makes me think now we actually, all of us, we do so many things
Yes.
and we don't even know that
Yes.
that we're shifting energies, whether it's something we say or how we treat somebody or how we manage, when we do hands-on work, whether we're physicians or anything else. The points we touch, right? The faces we make, the colors we choose, the gifts we give, that they all do shift energy. We just don't know that this is energy.
Yeah. Yeah. And it is
So,
very empowering. It's very empowering to learn
mm,
about that. And so you are, you see clients in person and you teach in person, and you're also starting to teach online. Do you also see, well, you see your Egyptian clients online. Do you
yeah.
see US clients online?
Some of them I do remote work, which is
Some.
not my
Okay.
preference. I really do enjoy the hands-on and the
Yes.
in-person work much more.
Yes.
But some of them, if they are out of state and I saw them before and then they need to continue
Yeah.
because they moved or they're just
Right.
living somewhere else, then I do also
You'll
distant
do
work.
some
Yes,
remote.
I do.
Yes.
Mhm.
Okay. Wonderful. Is there anything else you would like to share with us today about your work, Eden techniques, anything that we've kind of touched on, but you'd like to return to and elaborate on a bit?
I think the one thing I would want to say is follow your passion. Don't be afraid. If you're passionate about something, it's not random. There is definitely purpose and meaning in it. It's energy. Anything that you're passionate about, the appetite you have, the people you're drawn to, that's your energy. The people you're not drawn to, that's also energy. Follow it. So don't be afraid to shift and change. It is really about following and trusting what you're feeling, and you trust that you will be fulfilled and find your purpose, and you will be supported on that journey. New doors will open, new people will come, new friends, new family will be built. The other thing is, I would really encourage everybody, because energy medicine is, and Eden energy medicine is so easily accessible and so freely and widely available, to just peek online. There are so many YouTube videos where you can see the biggest inspiration is Donna herself, as so many videos throughout her life, and the basic techniques for anything. You can just Google, Eden energy medicine for headache or for menopause or for anxiety, and see
Yes.
Donna and her daughters and many of the amazing practitioners out there have so many videos out there. Just be curious and peek and see and feel. Try to follow
Yes.
them and do it and
Right.
feel how that impacts you.
Yes.
Just with a
I
little bit of
love
curiosity.
I
Yeah.
love that you emphasize that because I think that is the perfect thing for us to reiterate here is that anybody can go on YouTube and
Mhm.
Eden Energy Medicine for headaches, for pain, for fatigue, whatever. Test it out. Give it 15 minutes and see how you feel. And, if it's really amazing, keep going. Or if you're intrigued, keep going. See a practitioner if you can. I know I started with Donna's books. And Donna used to travel around the country. I've been able to meet her twice, which was extraordinary because anyone who looks on YouTube will see she is probably the most radiant, joyful person you've ever met. But, you can really start anywhere. It's wonderful to work with a practitioner if
Yes.
possible, but test it out and
Yes.
see how your body and emotions feel.
Yes, you will not regret it.
Yeah. Yeah.
Start somewhere.
Thank you so much, Dr. Dalia Elimam. I am delighted to have learned about your story and all that you have integrated and how joyful and fulfilled you are now that you are really combining all of your types of expertise in service to other people and yourself and your family. I really enjoyed being in conversation with you. Thank you so much.
Thank you so much, Sarah. It was an absolute delight and very much an honor to be on your podcast and to meet you and talk to you. And I hope that I could give some positive energy to your audience and some insights. And I really enjoyed this too. And thank you for being you and for what you're doing. It is absolutely so important to have people feel safe to choose what is right for them and to help themselves.
Thank you.
Thank you.
Thank you. Thanks for listening to the Alight Podcast. My guests and I are honored to support your self-empowerment, self-healing, and soulful contributions to humanity and Earth. To learn about my services, visit www.alightinstitute.com. And remember, the calling in your heart is real. Our world is waiting for your loving contribution. Your life improves when you step forward as your authentic, soulful self.